Hi, my name is Ryan Benavente, and this is my project that I did in conjunction with the Miller Center. This is telehealth marketing to build patient engagement in low resource settings. And today we're going to be exploring one of the most cost-effective approaches taken from public health methodology, also with an intersection in psychology and marketing, which is social marketing. And this is essentially a cost-effective approach towards greater accessibility in medicine and one strategy that can be used to improve health outcomes across the world. And so a little bit about myself. Uh, like I said, my name is Ryan Benavente. I am a major in neuroscience and biology, and I'm a minor in chemistry. And I did this project in conjunction with the Miller Center, whose mission is to essentially reduce global poverty and improve on several of the UN's sustainability goals, one of those being healthcare, which is directly correlated with the impact that poverty can have on devastating a community. And so in my interests, and one of the reasons I chose to pursue this is because I'm very interested in medicine and healthcare systems, especially how they are formed and how they are maintained. And I also am very interested in accessibility. I really do believe that we should live in a society where everyone has equal access to healthcare, and not just equal in ability to receive healthcare, but equal in outcome, equal in ability to access the best care possible, and as well as equal access to information and health education. And this ties a lot in with my interest in culture, connection, and community formation, because I think that these are three things that are fundamental to the human experience. And I want to be able to really interweave healthcare and medicine while keeping respect for those three things, because that's what makes us human. And as you'll see in my project, keeping in line with how a culture or community views something is important to getting people on board to taking care of their health. And so I looked at social marketing, and what social marketing is it's this approach that's used to successfully foster behavioral change. Um, it's an interdisciplinary approach, which uses concepts from psychology, neuroscience, business, um, and public health. And it's trying to get people to change their behaviors, especially those that are detrimental to their health and detrimental to their safety. One of the most successful social marketing campaigns is America's anti-smoking campaign. Although we see a resurgence in kind of e-cigarettes and vaping, smoking has drastically been reduced since the 1960s through effective PSAs and through effective anti-smoking campaigns. Um, and this is becoming a more widely used method, especially because we don't have to just rely on television ads, radio, and posters and conventional means of advertising. We have technology, and that increases our ability to interconnect with other people. And one of the other benefits is that it's cost and labor effective, able to reach a wide audience because of the technology that we have, social media. And we do see that it's able to be applied to the global south. Social marketing has a lot of benefits, and studies have shown that social marketing has improved the global south, especially those in sub-Saharan Africa's access to vaccines, access to fortified rice and essential vitamins, all of which improve health outcomes. It is the dissemination of information. And so how can we apply this? So I worked in the summer of 2021 with Access Afia, and Access Afia is a social enterprise, and their mission is to create access to quality healthcare for the global mass market through sustainable care models. They had some issues, and we were brought in to investigate why they had some of these issues. And these issues included scaling, customer retention, and customer attraction. They had an incredibly great business model. It was affordable, it was cheap, and they offered quality healthcare. But they weren't getting the customers that they anticipated. And so to investigate this, we distributed around 30 qualitative interviews where we would sit down with patients and talked about what they liked and didn't like about the company. We distributed surveys to analyze customer behavior. And we also analyzed several submitted surveys in the past that Access Afia had distributed to their clientele, as well as analyze a lot of the metrics and advertisements that the company was putting out to kind of investigate how they were marketing their company and if they were effective at disseminating the information that, Access Afia is this wonderful organization that, can really help people with accessibility in healthcare. And what we found was incredible. We found that Access Afia, they across the board provided excellent care and inspired customer loyalty, which was, a really, really interesting finding. And that made us go back to the drawing board, because originally we thought perhaps, they weren't doing what they said in their advertisements or as they promised. But we found out that patients loved them. And so that, drew a bigger question, like, why aren't they getting the clientele base that they needed? And what we found is that their main means of marketing is through Facebook advertisements. And that is something that's very difficult to do in Kenya, in Nairobi. Nairobi is because what they neglected was that although Facebook has a wide reach and is able to target a larger audience, there's a huge culture of trust and a huge culture of connection over there, and a huge culture of networks that binds people together. And so what we found is that if you look at figure 1, Facebook ads, their customer behavior shows that most people did not buy anything that they saw in Facebook ads, but they were more likely to buy from family or friends, or for recommendations in their WhatsApp group chats, which is just a technological network. And so we found low engagement on their Facebook ads. And the current campaigns that they did promote on Facebook did not target the most valued parts of the AA service. They focused on more superficial things as opposed to the compassion that Access Afia gives, or the affordability. And we also found that there was a lack of customer information. The customers that were part of Access Afia, even though they said they liked it, were not aware of some of the programs and deals they were eligible for. For example, all antenatal care women patients are automatically enrolled in the Afia Mama program, which is a program that helps newborns and provides training and information and a bunch of other goodies for them. And around 50% of them said that they were not part of the Afia Mama program, even though everyone is pre-enrolled in it. And another around 60% of them said that they were not familiar with the discounts offered to the Afia Mama program, which shows a lack of knowledge. And so that brings us to our discussion. It is important to understand cultural context whenever approaching a situation, especially something like marketing. Cultural context is very, very important, and word of mouth marketing is a more effective way. And so that was one of the recommendations that we gave this organization. Facebook, while it does have potential to reach a wider audience, their engagement rates on Facebook were less than 1%, which is very low even for healthcare marketing standards. Instead, they should rely on word of mouth marketing, which is a far more effective means. And as you can see from our surveys which analyze customer behavior, most people in sub-Saharan Africa will only buy products recommended by friends, family, or from close networks. And this brings us to this idea of customer evangelism, which is using your customers as your spokespeople. Because there's such a culture of trust and reliability that's built into Kenyan culture, it's important to use your customers as spokespersons and liaisons for your company and your organization to reach out to other people. And this is kind of one function of social marketing that we really, really stress. And one way to promote customer evangelism is through educating your customers. Because if your customers are not familiar with the deals that are incredible that they're getting, or the programs that they're enrolled in, how can they spread that information? And the overall importance of this study that I find interesting is that you can use the findings from this case study as a social marketing model for other social enterprises who are struggling to get their clientele base up into scale and to get greater subscription services or greater customer retention. It might not be an issue where there's anything necessarily wrong with the social enterprise itself and the organizational structure, but it might be the way that it's being marketed. And so marketing is an incredible way to reach a large amount of people which ultimately, as I mentioned in the beginning, increases health outcomes.